Hey everyone, and welcome to your first video lesson. This is video lesson number 1 for the Introduction to Pathology, Module 1 in your Radiographic Pathology course. And I need to say a few things about these videos before you continue on. The first thing is this particular video for Module 1 only is optional. The video lessons from Modules 2 through 6 are required simply because I'm able to put up an x-ray and show you pathology on that x-ray right on your screen. So it's going to be a great visual learning tool, and I think you're really going to like it. This first chapter, however, is a lot of definitions. It's a lot of words where you don't necessarily have to watch a video in order to understand. So for some of you, reading the book is all you're really going to need. In addition to that, I also highlighted the text that's important and put it in a document form on Module 1. So if you go back to Module 1 and kind of flip through, you'll see everything that you need to know in a highlighted text form. So that might be all you need for this first week. There is an assignment associated with week 1, and if you get that done, that is really going to help you prepare for the test. So it is having you go through this information, go through your book, pull out those answers, and by knowing the answers to those questions should really prepare you well for the test coming up on Friday. And so with that, I would love for you to stick around, watch the video. If you're a person who likes to listen to somebody and you retain information that way, this video is for you. If you're a reader, you do not want to listen to the sound of my voice for the next few lessons, don't feel that you have to for this module only. But again, modules 2 through 6, you will have to watch those videos. So with that, if you're sticking around, great. If not, I'll talk to you all later. If you have any questions regarding any of the material, don't hesitate to email me. All right, so let's just jump right in. So we're here for radiographic pathology, and the first thing we need to know is understand that word pathology. I think we understand radiology and radiography and all of that, but pathology is something that we might be new to. So pathology is the study of diseases that can cause any type of abnormality in the structure, function of various organ systems. People who study pathology, people who study disease, are epidemiologists, and those people study the determinants of disease in events in human populations. They often come up with different statistics, and two important statistics that they often talk about are morbidity rates and mortality rates. The morbidity rate is the rate at which an illness or abnormality occurs within a population, and the mortality rate reflects the number of deaths by certain disease per population. So we talked about pathology, we talked about epidemiologists. What is disease? Because they study disease. A disease is the pattern of the body's response to some form of injury that causes a deviation from normal conditions. So a disease can be caused by a number of things, including trauma. So trauma does cause a body's response, and trauma causes a deviation from normal conditions. So trauma could be considered a disease. But diseases can be from a number of things, such as hereditary reasons. You may have a disease that's passed down from generation to generation. Infections, there can be vascular and metabolic processes that start diseases. But all of these diseases will have some sort of sign or symptom. Now, we should be fairly familiar with signs and symptoms because we usually talk to our patients, and we might have to put down notes or signs or symptoms for the radiologist to explain to the radiologist what the patient is feeling and where they're feeling it. But we need to distinguish the differences between a sign and a symptom. A sign is a measurable or objective manifestation of disease. So it was something we can put a number to. A sign would be temperature. A sign would be blood pressure. So those are all measurable. A symptom is a little bit more subjective. And the big thing that we usually deal with is pain. Pain is subjective. And I know that there are those scales seen in the emergency rooms. Usually there's like a smiley face on this scale, and you follow the smiley face and it's progressively getting more and more distraught or sad. And that's trying to put a number to this symptom. But pain is different for different people. Different people have different pain tolerances. So a symptom of pain is a subjective manifestation. Different people will experience pain differently. So when you hear the word pain, that is a symptom, not a sign. With regards to types of diseases, there are 4 that I want you to be familiar with. The first one is iatrogenic diseases, and these are diseases that are caused by a physician or their treatment of the patient, or a physician's treatment of the patient. So that's iatrogenic disease. A nosocomial infection is an infection that is started by being an inpatient at a hospital or acute care facility. That is considered a nosocomial infection. The most common nosocomial infection is a urinary tract infection, and usually that is associated with Foley catheters. The next one is something called community-acquired infection. A community-acquired infection is an infection that's contracted in a public setting or place, but not at a hospital or acute care setting. And then the last form of disease you should be aware of is an idiopathic disease, in which case the cause of the infection or disease is unknown. So those are the 4 types of diseases you should know for the test on Friday. Study them up. And with that, I'm going to stop here. So I know this is a short lesson, but I have a feeling some of you might like it that way. Hopefully I see you for the next lesson, in which case we're going to talk about the body's reaction to disease. So I'll see you there.